what's new in the lab. And as Saul and I were talking prior to this this presentation starting, it's always challenging when you do a webinar because you're going to get people of all different kinds of levels of experience. And so I wanted to put something that could maybe appeal to people that are new learners and people that are experienced learners. So we'll talk about, I'll try to introduce some of these selective topics related, things that I think would be relevant to biomimetic dentistry with the projects that are some of the newest projects that we've completed in our labs. It's not like totally comprehensive of any particular topic. It's just a bunch of kind of different topics, but they're just things. That's why it's called What's New in the Lab. Just some things that we've been testing recently in the laboratory that I thought that should be interesting. So anyhow, I'll just explain a little bit how we do what we do in our lab. So I have a lot of my family sometimes will say to me, okay, Nate, you're a researcher and you work in dentistry. Why don't you just invent a new dental material so that you could be rich and you don't have to do dentistry anymore? You could just have some new adhesive or whatever material, and then you could just make that all the time. And I'm like, that's just not the nature of the type of researcher that I am. Even though, when you think of sometimes when we have dental students come, I want to do a research project, they'll talk about something they want to do. And I'm like, even within the field of dental materials, there's different types of areas that you can focus in. So there's some people that work for maybe Curari or something. Curari is a great company that they have a lot of chemists, a lot in Japan, chemists in Japan that formulate the new adhesives that we use and the new cements that we use, but they have a background in chemistry and they know how to fabricate things. Brian Nolan, he's a great example. He's a chemist by background, and so he has a great understanding of chemistry. There are some people that come into material development from a biology standpoint, especially now. There's a lot of talk of the composites that are antimicrobial and they have cautionary ammonia compounds and things like that. There's people who can study the biological response of materials. My background is in engineering, so I was a biomedical engineer in college. That's what I did. My PhD in dental school is all in engineering. So that's kind of the way that I approach it. I don't formulate things, I just test things that are already in formulation. So that makes my family sad because I'm not going to be able to invent anything, just test things that are already there. And we do a decent amount of this in our lab where we just make, follow ISO standards. Like this is a flexural strength bar we'd make out of a ceramic and just test it in our lab and give you a flexural strength value. But one of the things that I've noticed about being a engineer and a dentist is when we have a pros resident that wants to come and do their master's project in our lab, I'm there as the research guy, and then the rest of their committee is our prosthodontist clinicians, and they say, okay, if we've got some new material coming out, we don't care necessarily about its flexural strength. We want to know how does it perform in a clinical situation. So they want to know, how does the crown perform? We don't care about the flexural strength. How long is the crown going to last for? What study do I look to answer this question? What is the best adhesive? I know the study's old, but I still love this study, and I haven't seen this updated. This is from, the guy that I really think is the cool dude in research is Bart van Mierbeek, coming out of Belgium, and his study from 2014, where he analyzed all of the clinical trials that were done up until that point and showed which ones had the lowest annual failure rate for class 5 restoration. So when we used to do clinical trials with class 5 restorations, we would, for adhesives, if a new company had a new adhesive, that's the standardized way you do it in a clinical trial. You do a class 5, you see how many of them have bad margins and how many of them fall out, and you try to follow it up for, in the US, we usually only got funding to maybe up to 5 years. And here's some pictures from the clinical trial that we ran with Scotch Universal, and we had some teeth where we etched enamel and some teeth where we didn't etch enamel. And I always think this is always nice data to look at to show the importance, I think, of etching enamel. So here are some class 5s that were done. ENR means etch and rinse. SE means self-etch. And then, 5 years later, without etching enamel, you can see these enamel margins look a lot better than the ones without etching. So etch and rinse better than self-etch. Etch and rinse versus self-etch. So here self-etch, more staining at the margins.
As Dr. Lawson mentioned, we evaluated the effects of different curing modes in 2 different curing units with the bonding of 2 gold standard bonding that we have in the biomimetic, that we usually use in biomimetic dentistry. So in the method materials, I sectioned this part in 3 parts, which is preparing teeth specimens for bonding, bonding procedure, which is I divided to 3 sections, which is adhesive application, adhesive light curing, which divides our groups here, and using ultra-thin bonding clamp, which is the shear bond, like a standard shear bond strength for the bonding protocols. And we have also aging process and shear bond test. For the adhesive protocol, I'm going to talk separately about the steps that we use for the adhesive protocols, and I'm not going to talk about the cure, and I'm going to have the curing process at the end. So in the beginning, I'm going to talk about the OFL, which is very, very, very technique sensitive, we noticed during this process. First step is the etching process. We use the etching material, the phosphoric acid that we have in the OFL kit for 15 seconds. This application is a kind of important because we didn't want to rub the edge, but we want to ensure that continuously we have the contact of the edge to the dentin surface. So we have a kind of gentle agitation, which produce a kind of movement inside the etching gel to have always contact with the fresh edge.